Welcome once more to Ask Your Midwife. Today we are going to talk about the physiological changes that occurs to a puerperal mother or a woman who has delivered, and I'm going to limit the changes to the reproductive system. There are a lot of physiological changes that goes on in a woman who has delivered, because during pregnancy the entire system undergoes changes. The cardiovascular system, the respiratory system, and any system you can think about. But today I'm going to limit it to the reproductive system, and I'm going to talk about the changes that occurs in the uterus after birth, changes that occurs to the ovaries after birth, changes that occurs in the cervix, and then also changes that occurs at the perineum. So welcome once more, and thank you for joining me. My name is Patience Efrifa. You can also address me as Midwife Efrifa. Now, with the changes that occurs in the uterus, when a woman hasn't delivered, or when a woman gets pregnant for the first time, or the first week up to 12 weeks, the uterus is found, or is part of the pelvic organ. When I say the pelvic organ, I mean that the organ that is found beneath, that's your waist side, the bone here. Yes. So during pregnancy, as the pregnancy grows, this uterus now rises up to become an abdominal organ, and that is where you see that the woman's stomach has become big, and you know that is where you're able to see that yes, this woman is actually gross, she's big, she's pregnant. Now, as soon as this woman delivers, the changes occurs as the woman is lying on the delivery couch. You will notice that as soon as the woman delivered, for men who have been to the labor ward before, they can attest to it, and our women who have been to the labor ward before too, they can also attest to it, that the uterine size, or the size of the uterus, immediately reduces as it empties out the baby, and then the placenta is out. It immediately reduces either at the umbilicus, or the umbilical region, or below the umbilicus. You can do so by using your hand to measure or to palpate. Now, the changes that occur begins from there. This uterus will have to involute. Involution simply means that the uterus will have to go back to its pre-pregnant state, to where it used to be, and it used to be at the pelvic region. The uterus is not an abdominal organ, it is a pelvic organ. So each day the uterus is supposed to reduce by 1 centimeter, and then by the 6th week you are not supposed to feel the uterus at all. That is where we will say that the uterus has gone back to its pre-pregnant state. Alright, now talking about the blood that comes out of the vagina, which we see after birth, you will notice that for those who have delivered before, you will also notice that as the days go by, this color, the color of the blood that comes out, which is known as the Lokia, its consistency and color changes, and even the quantity diminishes, or it reduces. Why does this happen? As soon as the placenta is delivered, it leaves a scar, or something like a wound, at where it was attached to the maternal decidua. Now, when this happens, the uterus on its own is a muscle. It's made up of muscles, a lot of muscles. So what happens is that the uterus will have to involute, and as it's involuting, it contracts, and the contraction involves the muscles of the uterus. And the muscles of the uterus, as it contracts, intertwine, interlace. The muscles is arranged in that way. It's intertwined, interlaced, and intermingles. So as it contracts, it reduces the placental site, and by so doing, these naked blood vessels, after separation of the placenta, it occludes them. So it says it forms something like a ligature to occlude these blood vessels. So the more the uterus reduces gradually, the quantity of the flow of Lokia, the quality, and then the color and the consistency is affected. So it does that until the placental site is completely healed. Then you don't see bleeding again, and you're supposed to see this by 6 weeks. You're not supposed to see bleeding at all. So you realize that as soon as you deliver, the bleeding color becomes red, bright red, because the placental site is fresh. Now, as the placental site starts diminishing, as the uterus also starts going down, then the placental site, as it diminishes, it also affects the color and the consistency. Then gradually, the color will change from bright red, then to pink, or sometimes brownish color, then to yellowish color, not deep yellow, but slight yellow, mild yellow color. Then till the 6 weeks, you don't see it again. So that's the changes that occurs in the uterus. Now, when you come to the cervix too, during labor or during pregnancy, it needs to what? Widen up or take up, so that the baby's head can descend into the vagina for it to be delivered. Now, as soon as that process goes by, the cervix will revert back to its pre-pregnant state, but not as it was before. For a first timer who hasn't delivered, for someone who hasn't delivered, you realize that the external os, that is the outside opening of the cervix, cannot admit a finger. But when you deliver, its shape, the external os, changes a bit. Under speculum examination, you realize that the external os, though it's closed, but it leaves a slit-like aperture, something like a slit, something small. That one, when you even place your finger, it can admit a tip of a finger. So this should tell you that the cervix, though it will revert back to its pre-pregnant state, but it won't revert completely. It will leave that slit-like aperture, which can admit a finger. That is what we also call the multiple os in midwifery. Now, when we come to the ovaries, the changes in the ovaries also depends on the breastfeeding rates of the mother, the demand, how the mother breastfeeds. Some will say, after delivery, my breast milk doesn't come. But let's bear in mind that the breast milk is like a well. The more you fetch, the more it comes. It is a psychological thing. As soon as the baby latches onto the breast, the nerves of the nipple will send signal to the mother's brain that there is a baby. Most mothers always expect that the breast milk will flow plenty on the go. No, it is a gradual process. It comes in bits, and the more you continue to position and attach the baby to breast, the more the breast milk flows. Now, this is what happens. You realize that as soon as you deliver and we give the baby to you within the first 30 minutes to breastfeed, you feel that sharp pain, the lower part of you feel a lower abdominal pain. That is the uterus, which is what? Involute. It is contracting. Yes. When it does that, it also helps you not to also it serves as a family planning method for you, the mother, as well. Because when it does that, it causes an ovulation. If you breastfeed well, especially at night, more prolactin will be released, and then prolactin will stimulate oxytocin, and oxytocin is a hormone. These things I'm mentioning, they are hormones. The oxytocin will cause the uterus to contract more, so that it can go back to its pre-pregnant state. And it also serves as a family planning method for you, the mother. But in a situation whereby you add other feeds or supplements, thinking that you don't have enough breast milk, you can resume ovulation early. And if care is not taken, you can become pregnant, because menstruation will set in early. I hope you get me. menstruation will set in early, because if you're able to breastfeed well, it will serve as a natural family planning method for you. But if you don't practice good breast, or if you don't practice exclusive breastfeeding for the first 6 months, my mothers, there is a possibility that ovulatory activities will commence. Therefore, so far as you are able to ovulate and then start menstruation on time, you are at a higher chance of becoming pregnant. Also, during pregnancy, there's increased vascularity to the perineum, the organ at the perineum, that's the vulva, and then the vagina. It becomes tortuous and then highly rich and vascular. But as soon as you deliver, within 2 weeks, you realize that the vulva, which becomes a bit edematous, will revert back to normal. At times too, with this normal physiology, if you, the mother, you don't take care of yourself very well. Taking care of yourself, I'm talking about normal personal hygiene. You're supposed to change your pad frequently, because blood serves as a medium for microorganisms to thrive. Bear in mind that the placental site is also fresh. So the moment you don't take care of your perineum, that is where the vulva is. Bear in mind, the vulva serves as a gateway to the vagina, up to the uterus, then to the entire reproductive organs. Now, if you don't maintain good personal and oral good personal hygiene during this puerperal period, you are at risk of ascending infections, which will go high as affecting the placental sites, causing microorganisms to thrive and multiply. And when that happens, you, the mother, are at risk of what we call subinvolution. This infection will cause lower abdominal pain, back pain, and then the bleeding will not stop, because ideally the bleeding is supposed to stop. But here lies that the uterus is not contracting. So instead of the placental bed or the placental sites where it's detached, it's supposed to reduce, then it will be there because of the infection, and it will cause a whole lot of problems for you, the mother. Thank you very much. Please, if you have any question, kindly type that question and I'll attend to you as soon as possible. Bye.